story now here for you this morning. There's a new study out of California that shows adult ADHD diagnoses are on the rise. This, of course, is attention deficit hyperactivity disorder. And joining us now to talk more about this is mental health counselor Shantala Boss. Shantala, it's always good to see you.
You as well, Danielle.
All right, so is it on the rise, or is it that now more adults are kind of recognizing symptoms that they may have seen in their kids and are realizing, hey, that's me too?
Yes, adults are recognizing the symptoms as well, and also it's becoming common knowledge that ADHD doesn't end in childhood. A lot of times we thought that, but about half of the children that have ADHD do continue it into adulthood. So it can be very common in adults.
So how do adults then seek treatment for ADHD, and does that treatment differ than, say, treatment for a kid?
Well, that's a good question, because a lot of times it's it's confusing how ADHD is diagnosed.
Let's talk about what it is. What is ADHD? I know it's attention.
Yeah.
But let's talk about what that means.
Well, ADHD is a lack of attention, impulsivity, inability to complete tasks on time. So for adults, it's really hard because they could lose a job, they're lacking focus, they're not meeting deadlines, and then in relationships, they're forgetting important dates, they're unable to follow through. So it can really affect their work, it can affect their relationships, and also there's some impulsivity. So they could be doing more spending or more behaviors that are very risky. Sometimes they tend to have more STDs, people with ADHD. So these are things that they really need to be aware of and know how to manage.
So they're aware, let's say, and they want to be able to manage it. Do you find that they are easier in terms of seeking help or more difficult in terms of reaching out for help?
I find that usually they come in with a different presenting problem. And that's why I want to talk about comorbid or dual diagnoses.
Okay.
So a lot of times people will be struggling with ADHD, and it's actually as a result of something else going in their life. They're having high anxiety, a lot of changes, severe stress, and we know that stress is on the rise as a whole in our society. So a lot of times ADHD is just a byproduct of that. And if those things were to be addressed and dealt with, the ADHD would go away. But then there's the opposite, where they have the ADHD, and as a result of the ADHD, they have anxiety and depression. So it's figuring out which one came first and then treating it appropriately.
So with about 30 seconds left, what are some coping mechanisms, and does that always include medication?
It doesn't always include medication. It's a good idea to go ahead and go to a psychiatrist and see what, if you have some other things going on, but following up as well with a therapist and finding out what some of those underlying things are, as well as how to get organized, how to stay on top of things, how to keep oneself accountable, and also how to express yourself to family and friends so that they understand. Also keeping a clear workspace, having sitting in front, maybe at presentations or meetings. So there are a lot of different strategies behaviorally, and having a therapist to help with that is always good and helpful.
And recognizing those underlying symptoms, I think that was one of the more important things you said.
Absolutely.
There's always something else underneath, right?
Yes, it needs to be dealt with.
Very good information, Shantala. Thank you so much
for having me.
We appreciate you. Have a good weekend.
You too.
It is